Hello, and welcome to the webinar today. We are here talking about connecting child welfare and early learning systems and how cross-sector partnerships can improve services and outcomes for children. My name is Renee Tetrick, and I'm a program analyst from Illinois Action for Children, and I've been working for the past 3 years with the Innovation Zone project, and I want to introduce my colleague here.
My name is Debbie Bridges, and I've been working with Illinois Action for Children on this particular project.
Great, and I just want to take a moment. Can everybody hear us on the webinar? Maybe if you can, someone can chat in and just let us know you can hear us.
Yeah.
Great. All right, so we're here to discuss how cross-sector partnerships and human-centered design can increase enrollment of child welfare-involved children in high-quality early learning programs. We're going to share some insights and lessons learned from our partnership, research, and co-creation process. And we're also going to showcase some marketing, communications, and educational resources created in partnership with the Department of Children and Family Services School Readiness team to help promote their work in enrolling children in the child welfare system and high-quality early learning programs. So I want to pause to introduce our School Readiness team, our partners in this project. I believe you guys are all unmuted, so if you could unmute yourself on your end and say hello, introduce who you are.
Good morning, everyone. This is Mary Beth Corrigan, Statewide Administrator for the School Readiness Team with DCFS.
Good morning. This is Diane, School Readiness in Central Region.
Great, and I think Martha, are you also on the call? And Diane? And Vanessa?
Are you not able to hear me?
Oh yeah, we can hear you now.
Okay, yes, this is Diane Lamont. I'm with the DCFS Central Region School Readiness. I have approximately 1,000 children in Central Region, and I'm responsible for 52 out of the 102 counties in the state of Illinois.
Great, thanks Diane. And Vanessa, are you on? Great. And I believe Vanessa's on, but maybe unable to unmute herself right now. So Vanessa and Martha are also part of the School Readiness team. So we'll have them share a little bit with us later. Before we get started, I wanted to get a sense of who is on the call. So we're going to go ahead and launch our first poll. And we're going to find out which systems are here today. I think our poll is having a little issues, but if you want to type into the chat box, give us a little sense of who's on the call. Are you part of the early childhood system, the child welfare system, or an other system? And we'll work through our technical difficulties. All right, the results are coming in. All right, great. Looks like we have 47% on the call are collaboration members, 6% system leaders, and 4% other. So feel free to chat and let us know who the others are. Thank you so much for joining us today. It looks like we have a lot of collaboration membership today. That's wonderful. All right, let's go ahead and move forward. So we're glad to have you here today. Today we're going to provide a little bit of context and background on our project. We'll provide an overview of the process, walk through some of the strategies and materials developed, and share our lessons learned. And we'll save some time at the end for question and answers. And I just wanted to make a note, if you have a quick clarification question, feel free to type that into the question box and we can take that right away. If you have a longer question, we'll save that for our Q&A at the end. And I'm going to turn it over to Debbie to tell us a little bit about the context.
Thanks, Renee. So though the focus of this webinar is going to be on the collaborative process and also on the strategies that kind of came out of that collaborative process, we did want to give just a little bit of context and background to everybody just so you understand kind of how we got to this point and how sort of this project came about. So in between, from 2013 to about 2015, Children's Home and Aid was given a federal grant to do some data collection on enrollment rates of children in the child welfare system. And they did that in several different communities throughout the state. And they expanded that data collection to include Thornton Township, or the south suburbs, which is where Illinois Action for Children has an innovation zone. And so it was in collecting those enrollment rates, seeing what those numbers were like, and also then having the innovation zone present there as well that kind of generated this project. We pulled out a quote here from an issue brief that Project Link put together that I think sort of encapsulates the thinking behind not only the project but both organizations. So it is critical that young children and families involved in the child welfare system have access to services, in this case, early learning programs that have the potential to mitigate the impacts of the trauma they have experienced. We wanted to show you just briefly some of the numbers that came out of that data collection in Thornton Township. You could see that the enrollment rates are low, and in particular, and it doesn't show it here, but even lower enrollment rates in Head Start and Preschool for All programs, and also Gold Star rated programs as well. That enrollment rate was more like 21%, and the rate in the federally funded and state funded preschools was more along the lines of 40%. So it was with this data, and then we'll show you briefly a little bit more of a breakdown. This data in Thornton Township, but then here we do a little comparing with some numbers in the greater Englewood community and also East St. Louis. These were also gathered previously by Children's Home and Aid. And you see that Thornton Township certainly is not the exception to the rule here, so that maybe some of the solutions or maybe some of the answers or ideas for interventions might actually be more appropriately a statewide kind of thing. So we just show you these numbers to just give you a sense of, again, sort of what the basis of this project was and how it all sort of started. And what those low enrollment rates left us with were a few sort of overarching research questions, which are these right here. Which strategies, practices, and procedures work and don't work and are not working for enrolling children in care and high-quality early learning programs? And then also, how might we increase those enrollment rates of children in care in high-quality early learning programs? So with that, I will turn it over to Renee with just that little bit of background, and she can start talking to us about sort of the process that we went through to sort of intentionally come up with some ideas before jumping in with solutions and interventions.
Great. So through our Innovation Zone work, we learned a lot about working with high-needs children and families and about our systems. And we know our systems are complex, our child welfare system and our early learning system. And our goal is to work together and use cross-sector partnerships and use our models and methods to make things easier and make our systems easier for families, caseworkers, early learning professionals to navigate. So using this thinking and this sort of working together, we're using a systems lens and using concepts from design thinking or human-centered design and also behavior science to make a difference within our system. So this includes understanding the users of our system. It includes looking at data, designing together, and testing out a small idea to really understand what's working. The overall vision of this project is to increase enrollment of child welfare involved children in high-quality early learning programs. This means bringing together two systems, our child welfare system and our early childhood system. It means collaborating across two agencies, the Department of Children and Family Services and Illinois Action for Children. And it also involved bringing together two teams, the School Readiness team at DCFS and the Innovation Zone Support team here at Illinois Action for Children. So the ideas are designed with a behavioral economics frame to help the system easily implement and meet needs of diverse families. And our proposed solutions are designed for simplicity and for practical and seamless implementation. So innovation approaches and strategies utilize a behavior science and a systems thinking framework. And we offer suggestions here based on research to streamline, clarify, and simplify language to make things easier to read and increase accessibility. So you'll see in the September 2016 U.S. Presidential Executive Order that behavior science can be used to design strategies and materials that are relevant and effective, and that behavior economics can help to improve how information is presented to audiences by considering how the content, format, timing, and medium by which information is conveyed can affect comprehension and action by individuals. So here's what we might get when we jump to solutions. We also utilize human-centered design approaches in our work to better understand our users' experiences and our user needs. And when we use design research and co-creation of strategies with our users, we get better, longer-lasting results. So our process involves a few things. One, we start by looking at data. And then we form a hypothesis and challenge questions using that data to help guide our approach. We get outside of the building to co-create and test using small experiments. We ask our users about their experiences. We make sense of that feedback. We rinse, we repeat, and we refine our strategies from there. And throughout our presentation, we're going to take a closer look at this process. And I'm going to turn it back to Debbie, who's going to tell us a little bit more about the research methods.
Yeah, so this slide details a little bit more specifically, based on this project, kind of the process that Renee just explained. So that this project was really designed to learn about the experiences of what Renee just referred to as the users. So this would be the parents, the child welfare professionals, caseworkers, supervisors, to really try to understand kind of the reasons behind the data that we saw in the project link information. Why are these enrollment rates low, and what's keeping people from enrolling their children? We developed scripts for focus groups. They were designed to pretty much ask the same types of questions of every group that we had. The focus groups, as you see in the second bullet point, were supervisors, caseworkers, family members, and parents. And the idea with the scripts was to pretty much, as I just said, ask everyone similar questions and then compare answers, sort of triangulate that information and see where there was agreement on what's working and what's not working, and where there might be some misunderstanding between the two different groups. Then once we collected that information, both in focus groups, and then we did do some telephone interviews with parents in DCFS, we did some analysis. We contracted with Maple Grove Objectives, and they did what I would call maybe a top-line analysis of the information, really coming together with what the themes were of the findings, the big picture analysis. And then Renee and I went through a process known as Pathway for Change. And this is a process that actually I'll talk a little bit more about in this next slide, as well as this draft opportunities memorandum, which is really when we started to get into different strategies. So the Pathway for Change process involved us writing down, this visually really shows this, I think, writing down all of the different sort of findings, so to speak, of our conversations with parents and with child welfare professionals, and putting them into buckets. For example, a bucket of documentation and frustrations with that, or misunderstandings with what's required, things like that, and then looking at from there, putting them into this strategy design sort of table. In the first line of this table, we have these issues, and they become our headlines. So as I mentioned, documentation, or inconsistent practices of caseworkers, or a lot of variation in terms of how caseworkers were working with families and how engaged or not they were in the process of enrolling children. And then from there, looking at what maybe some of those root causes are, and then finally from that point, then looking at what strategies might help to address those root causes. And I'm going to take a quick moment here to mention that this, along with some of our other slides, might be a little difficult to read. If anyone at some point, maybe in the question and answer, is interested in going back to any of the documents we show, we have clearer versions of them. It just didn't come through so well in the PowerPoint, but we're happy to go back to those if anybody wants to see any more specifics. So once going through this, this process of identifying kind of the larger issues and the root causes, we then created a strategy memo that became known as our opportunities memo. This was a memorandum from Illinois Action to the DCFS School Readiness Team, entitled Opportunities to Increase Enrollment in Early Learning Programs Based on Focus Groups and Interviews with Child Welfare Professionals and Parents. And so very briefly, what this memorandum did was first look at kind of some bright spots that we found in our discussions with parents and professionals, things that were working, things that sort of offered an opportunity to maybe scale up or replicate. And then we offered a section on kind of the things that Renee was talking about, more small experiments, smaller strategies that might be able to be implemented a little bit more easily. We could pilot them, test them, and then revise them as we needed. We also included some larger recommendations and strategy ideas on state policy areas, as well as areas for additional research, and then also some community systems development opportunities that all came out of these discussions, these focus groups, and interviews with parents. We did get some feedback from the school readiness team on this, and I'm actually not going to go into detail on that because Renee is going to talk a little bit now about sort of the collaborative project that we engaged in with the school readiness team, and she can take it from there.
Great. So co-creation is core to the process of designing better solutions and better strategies for our most vulnerable children and to improve our systems. Some of our approach we regularly shared at the All Families Served Subcommittee of the Early Learning Council to get their feedback. We sought regular feedback from systems users through these meetings and through a webinar presentation of our strategy memo. We hosted regular meetings, working sessions, and provided regular feedback opportunities to the school readiness team and their caseworkers on the strategies and steps forward. And we'll talk about the next steps that we'll use to continue this co-creation and testing process with caseworkers and families. So to give you a general sense of our timeline for this project, project link data was collected back in September of 2015. The focus groups and interviews with caseworkers, with child welfare professionals, caseworkers, and families were conducted from April to June 2016, and those again were in the south suburbs in Thornton Township. That data was analyzed and presented in a strategy memo in August of 2016, and co-creation began with the school readiness team in September to March of 2017. And then testing, information gathering, and iteration will continue further from there. So we wanted to give an example of our co-creation process. Here is an example email requesting feedback on the recommended strategies through individual interviews and surveys with the school readiness team. So input on strategies and prioritization was a regular part of this project. We also hosted a few working sessions with the school readiness team to share prototypes of the materials, tools, and content that we created. These guided sessions really allowed for discussion and openness and the ability for the team to create together and iterate on these materials. Here's an example of 3 prototypes that we created in collaboration with a graphic designer. And we worked closely with the school readiness team to understand their needs and their users and to get feedback through them on which sort of prototype would work best. And these feedback sessions really allowed for some quick, clear understanding of the team's needs and their caseworker needs and allowed for really easy user insight into the materials we created. So this one's a little hard to see, but I wanted to share a bit more detail of our timeline. Once we got to a point of prioritizing strategies, we put those into a timeline to move our strategy design process forward. This started with our design and development there in the orange phases, our coordination and collaboration there in red, and then testing of the strategies, materials, and small experiments there in blue. And I'm going to turn it to Debbie, who's going to get into some specifics of the strategies.
Okay, so we've talked about the research and collaborative process kind of behind the strategies, and as Renee just mentioned, we'd like to share some details about some of the actual strategies and materials that we've created. The strategies that were co-created were selected as the ones that we decided to pursue were those that were in that more small experiment section of our opportunities memorandum, thinking that those would be some quick wins, I think, and could be tested and then scaled up if found to be effective. All of these, of course, with this goal of increasing enrollment of children in quality early learning programs, children in care. So with each of the strategies, too, they all address they all have this a goal, and then they all, we've entitled it an insight here. They all use insights that we gleaned from our focus groups and interviews, but also looking through the lens, as kind of as Renee had talked about earlier, of behavioral economics, but also strategic marketing approaches, particularly for service industries. So we were kind of looking through all of those lenses when designing any of these strategies and concepts. So the strategies that we created can be kind of put into 2 general categories. The first is elevating the school readiness team, to elevate their awareness of them and use of them and awareness of the supports available from the team as an effective way to address some of the prevalent questions, concerns, confusion that we found in the focus groups and interviews. So this idea of connecting more people to the school readiness team, creating materials that will facilitate that, and materials and ways of encouraging more contact with, more connection with the school readiness team. So the positive goal with this strategy of elevating the school readiness team is to position the team as a key in DCFS's overall strengthening families approach, and more specifically, as we've talked about, in increasing enrollment of children in care in early education. Build awareness of the team, the staff's expertise, and when and how to contact them. And we can get into that a little bit, but in a minute, this distinguishing between the school readiness team and other supports that are available within the system. But in other words, so the idea is to, in essence, operationalize the school readiness team's mission, which is 100% enrollment of children in care, with some tangible goals and tactics to build the team's brand with child welfare professionals, and then also with caregivers as well. So to support and strengthen the team's relationships that they've already built, but to help them build additional ones, particularly with POS agencies. And then also, as I just was talking about, differentiating the school readiness team from other supports within the system. So the insights, again, looking through those different lenses that help to form these strategies include these: approaches and strategies to streamline, clarify, and simplify the language and visuals, behavioral economics, as Renee was talking about earlier, marketing strategies to build awareness and utilization of the team, and then the idea of effective, clear, consistent messaging to establish the team as a go-to resource for support on early education for children in care. So specifically, we'll go through just a couple of the actual concepts, materials that came out of this, this overall strategy of elevating the school readiness team. This is a PowerPoint presentation that the school readiness team shared with us that had been created to be used with a number of different audiences to talk about the school readiness team, but sort of some broader topics within DCFS. So what we did was take a look at these slides through these lenses that I had just talked about and try to sort of evaluate them for ease of reading. Are they easy to follow? White space, using bolding, looking at ways to simplify language if we can, make it crispy, and then definitely including information like how to and call to action. And in this case, this example of this slide is how to contact the school readiness team, and to offer that in a way that's easy to follow and read, and you can quickly, with the idea of putting the map there, you can quickly locate who your regional person is and then know who to contact for support within your region. This next slide also was part of this presentation, and we include this just to, again, sort of give a visual of some of those goals that we had in terms of simplifying and making it easy to read and follow. But also this idea, back to one of the slides that Renee showed earlier about the design concepts that we shared with the team. We offered 3 different ideas, and the school readiness team chose one. It wasn't this particular one, but the idea of having a look, so to speak, a look for the brand of the school readiness team and carrying that through every material or every presentation that they use, so that it's they're easily identified and it's just a strong branding for all sorts of audiences. Just a couple other concepts within this elevating the school readiness team. We did put together a number of one-pagers, and this is an example of one that was along the lines of who to contact for answers to questions about finding, choosing, and enrolling children in early learning / preschool programs. This became pretty clear in the focus groups that there was some confusion among caseworkers and even supervisors as to who they should contact within the system and who they should contact with what types of questions, particularly with regional education advisors. So this piece was put together to really very simply list when to contact the school readiness team, why to contact them, how to contact them, and then as a side note, in different situations, here's where to contact the regional advisors. So again, distinguishing the team from other supports available. A second concept within this strategy also was an elevator speech that we put together for not only for the DCFS school readiness team members, but also could be used, we did a slightly different version that could be used by staff within DCFS who could also be the messengers of who the school readiness team is, what they do, and how they support caseworkers and caregivers within the system. So just a quick, I won't read it, but just a quick 30-second summary snapshot of what the school readiness team does, and then hopefully ending in a handing off of a business card or a one-pager that explains even more about what the school readiness team does. So in addition to the elevating the school readiness team, the second group of strategies is this idea of navigating the enrollment process. And this includes caseworker communication, caseworker education, and then also clarifying documentation and eligibility. So these tactics kind of under this bucket of strategies and materials seeks to to really empower and educate, build skills among caseworkers and other child welfare professionals so that they, in turn, become the agents of change. And they are part of this effort to enroll more children successfully in quality early learning programs. So I'm going to first talk briefly just about casework communication, the goals, insights, and then just a couple examples. The goal here is to frequently connect child welfare professionals to user-friendly, valuable, up-to-date early learning program enrollment tools and information to support them in their efforts to increase enrollment of children in care in high-quality early learning and development programs. So that's the overarching goal of these. The insights guiding these strategies include some targeted focus group findings to reach some of the team's prioritized goals that Renee mentioned. An example of that is strengthening their relationships with POS agencies, feeling that that was an area where they really wanted some support. Frequent accessible information to plant and prime for regular practice related to enrolling children, sort of getting in front of caseworkers and supervisors on a frequent, regular basis, often with good, valuable information. And then also designing how the information is presented in order to really affect the comprehension and action of those audiences, whether it's caseworkers, caregivers, early learning providers, to really look at how we can design materials that could actually be tweaked to work with any of those audiences. So within this strategy, we developed some what we called articles and website links. The articles were could literally be articles for newsletters, could be articles on websites, but also could be used as handouts, as I'll show you in an example in just a minute. But this idea of the frequent value-added information for busy child welfare professionals, making it easier for them to connect to resources. It became pretty apparent in the focus groups and interviews that there are a lot of resources out there on early learning programs, and how to sort of cull together all of that information and just make it easy for them to get to the information, whether it's DCFS's website, school readiness team on the phone, that type of thing. So that was the thinking behind some of these articles. The topics we've listed here: finding an early learning program that fits, starts with knowing what's available. This was a table that we put together that really detailed federally funded programs, state-funded programs, home-based programs, home visiting programs, looking at not only documentation and eligibility requirements, but sort of the benefits of some of those programs, particularly for children in care, and then maybe some of the limitations for those children. We put together a number of different sort of checklists that would help with choosing a quality early learning program that would fit. And then we also put together a pretty exhaustive list of links to resources on just any number of issues with enrolling and with finding and choosing an early learning program, particularly for children in care, with the idea that these could be, as I mentioned, you could have links on the websites to these, you could put them in newsletters, they could be an email blast, just a lot of different ways to distribute these different articles and one-pagers. So here's a quick example of one of these, and this is actually a two-sided one-pager that we put together for the school readiness team to have on hand at conferences, agency presentations, maybe early learning provider open houses. Just a number of different audiences this could be used with for the school readiness team to be providing a valuable resource. And this goes through finding, choosing, and enrolling in an early learning program. We developed two versions of this. One, this one here that we're showing is for children in care, and also put one together that was more generally just for children. The back page was probably the most specific to children in care, because here we get into a little bit of the documentation required, into some of the eligibility requirements, For example, in this table about documentation, proof of income would have that no proof of income is required for children in care, whereas the documentation needed for other children would be listed on that version. So again, just trying to develop a tool that could be used flexibly with whatever audiences the school readiness team might be encountering. A second piece of this strategy, navigating the enrollment process, I mentioned before, is caseworker education. We're going to go through just a couple examples of that. But first, this is the goal I mentioned before, really empowering and equipping child welfare professionals as change agents to support families in enrolling their children. These strategies here kind of even more directly do that, giving caseworkers the tools and resources to do just that, really engage with families and successfully enroll their children in early learning programs. The insights here, again, targeted focus group findings to support caseworkers' need for information and tools to navigate the role with families. We found, as I mentioned earlier, quite a bit of variation within the caseworker groups that we talked to as far as how involved and how much time they spent or even could spend based on their caseloads with families taking on this navigator role. So if there's anything we can do to make that easier or more, easier or less time consuming, that was sort of the goal of some of these strategies. Clear, visible strategies and practices to help caseworkers do what they want to do already but may not feel they have the time to. And then also opportunities to build networks, not only for the school readiness team with caseworkers and supervisors, but also among child welfare professionals, because we found that, as I had mentioned, many caseworkers are very engaged in this process and really could be a resource for other caseworkers within the system. So this first concept was to put together a brown bag lunch series. And this would be a series of presentations that the school readiness team could give to, again, a number of different audiences depending on the needs of their region. And what we did is we developed the first of the toolkits in this series. And we had talked about a number of different possible topics to be included, to be covered in this toolkit, and it was through this sort of co-creation process that navigating the enrollment process was what was decided would be our first topic, and that would be piloted in one of the regions in the state. And then with the idea that we would gather feedback and sort of tweak things as needed based on the school readiness team's experience with it as well as audiences' experiences. So the theories behind this presentation were really to take an adult learning approach, which would include individual and group activities to generate discussion and a deeper understanding and buy-in to the messages and to the tools and to the techniques, but also really designed it to work on multiple levels of learning for those who were participating, not only just awareness and understanding and knowledge, but also really applying that knowledge, building skills, and then actually working on and practicing and developing those skills. So obviously all with the idea of motivating attendees, these caseworkers and supervisors, to incorporate this new learning into their support with families in navigating the enrollment process. This toolkit included, you can see the table of contents here. We have the presentation objectives, everything from the materials needed, a sample sign-in sheet, tips to secure a location, and then some templates for inviting participants, confirming their participation, thanking them, and then also a full outline and timing of the presentation, as well as a guide that included, here's an example, included the actual slides that could be used, and with the thought that we would provide these to the school readiness team and they could tailor these to their needs. They could, we would give them to them online, they could download them and tweak them as they wanted to. So the goal of this brown bag lunch being sharing those strategies and knowledge, providing useful up-to-date information, suggesting resources, This fourth one is important, though, this idea of gathering new ideas from the field. This whole idea that this could be, again, part of this process of getting feedback and getting ideas from the users and really incorporating that into any additional strategies or materials that would be developed, and then answering, of course, any questions. This is just an example of the outline of the timing of the presentation. Again, with some options to customize. You can see, if you can read this, there's an optional videotape testimonial from a caseworker. If that was something that one of the team members would like to include and drop into the presentation, there was time left for that, and we gave some suggestions on how that might be done and what the topic might be. And then one last little piece we're going to show you on this toolkit. Again, it's part of this process of getting the feedback. We developed a survey for participants to get an idea of what their experience had been like in that presentation, but then also asking them for what other kinds of topics they'd like to learn about in future presentations. So that was that idea with those brown bag lunch series. The last of the caseworker education strategy was to put together a very simple navigation guide with clear language, some simple steps, useful tips, and again, providing sort of some cold resources that could be easy to use for caseworkers and easy to access. So the guide itself was really was put together for caseworkers to walk through with a family. And as we learned in the focus groups, that may or may not involve all of those steps. You might be jumping in at step 3 because a family has already done step 1 and step 2, and they are not necessarily needing that support from a caseworker. So the guide would take you through all the different steps, but caseworkers would have the option of jumping in where they felt the family really needed the support, whether it was making the decision to enroll a child, understanding the types of quality programs that are out there, finding programs within the community, choosing and visiting the program, selecting the program, and then completing the enrollment process. Those were kind of the different steps so that caseworkers could jump in at any one of those times and work with families. So I'm going to pass it to Renee to talk about kind of the last concept of this strategy category.
Great, and I wanted to make just one comment. I'm going to pop back to this slide. As you'll see, this is an earlier version we had of this caseworker navigation guide, and again, just to kind of reiterate that idea of co-creation. So this is where we had one of those co-creation sessions with the school readiness team. They had shared with us this idea around the steps to include. We drafted something, prototyped something, got some feedback from them, but also Vanessa, one of the team members, was actually able to take it to some caseworkers, get some direct feedback from them because they're the user, right? They're the one that's going to be using it with the family, so it has to make sense to them as the user of this guide. So our latest version looks a little bit different than this based on that feedback. So then our last part of navigating the enrollment process is clarifying documentation and eligibility. So the positive goal here is that came out of our focus groups was to empower and equip child welfare and early learning professionals with clear, easy to read information on documentation and eligibility across systems. We learned in our conversations that information about requirements tended to vary across systems and across different programs. The barriers reported by caseworkers and families suggested a need for cross-sector clarification and information sharing about eligibility within each other's systems. The concept here was to draft some user-friendly policy documents and handouts that use clarifying language that are easy to read and provide access to additional resources. Here on the screen is a policy document that outlines the rules, requirements, and resources, including key points and specific details within the different systems. Here's another handout that we created about eligibility requirements for Head Start and state-funded preschool programs. This could serve as a standalone handout, or as part, we also included this as a part of our brown bag toolkit, so kind of a takeaway document for that series as well. Here's a complimentary handout about the documentation requirements. You'll see that each document is clearly laid out with headings and specific details. And we can take a closer look at these if anybody's interested in the Q&A. So those are a few of our strategies and the materials that we created as a part of the project. And we'd like to take a little time now to share some of our lessons learned. Let's start first by opening up the conversation to the school readiness team. All right, so first of all, I want to thank the school readiness team for being a part of the call today and for your partnership in this project. It has been quite a pleasure. And I thought I'd just open up the conversation with a general question to you first. What was your experience like as a part of this project?
Again, this is Mary Beth Corrigan with School Readiness. Initially, I think when we were approached on this, I thought this is really going to be a massive undertaking. It's going to be time-consuming. We have to pull all of this together. But what we found, I think, in working together really opened up communication for the team. I think it also gave them an opportunity to kind of dive deeper into the work that they're doing, and it really helped them to, I think, gain a larger perspective on the work that we do via the state. So I really think that it was a tremendous effort by everyone. It really helped us to focus and narrow a lot of our materials and documentation. The team were able to give comments, and as again stated, one of the staff took it back to caseworkers, and really were thoughtful in what they wanted to see and how they wanted to see changes, because every time we were asked to do something, we quickly had to make adjustments or changes to a document, and the way in which this has been presented to us is we can tweak it as we evolve and continue to enhance these different documents that we have, and we're hopeful at some time that we will be able to make this part of our actual system so that any of these documents can be accessible online to anyone who needs to have them. So again, I just think that it really kind of broadened everybody's knowledge. It gave the team a voice into the changes that they needed and really what they wanted to see. And it can be kind of created for each one of the different regions, because we know each one has kind of a different culture. And so I think for me, it was just really kind of demonstrated the effectiveness of collaboration, and it took it to a whole nother level. So I'll let my other team members speak.
Thank you, Mary Beth. That was great. I'd love to hear from any of the others. Vanessa, Diane, Martha?
Hello, this is Martha.
Hi, Martha.
Can you hear me?
We can.
Okay. I was having problems earlier. Good morning. My name is Martha Babington. I am assigned to County Region. And first of all and foremost, I would like to thank you, and I appreciate all your hard work that you put in this project. You have made it easier for the caseworkers to find out what information they need to enroll children in care. You have also helped us a lot with all the information you provided us with, and this information that is going to be very useful to the caseworkers and for the children to be enrolled in a high quality learning program. And this information is very valuable and knowledgeable. Thank you.
Thank you, Martha.
You're welcome.
I'm also curious, what were your greatest lessons learned from this process? I wonder if Diane or Vanessa, if you're on and you wanted to share anything about your greatest lessons learned from this process and this partnership.
Good morning. Can you hear me?
We can.
Okay, this is Diane, and I'm with Central Region. was having a little bit of difficulty, like Martha, trying to get the unmute button to come on. But I too, like Martha, would like to thank you for all your hard work, both Debbie and Renee. It has been an extremely motivating experience for myself to be part of this collaboration. We have faced many challenges since we have come on board. Mary Beth could probably speak better, but School Readiness was developed in 2008, and it was a statewide initiative. And she had a great team, and then as time passed, many of the team members left, and it left Mary Beth and one of her staff to do all of the state, trying to get 2.5 to 5-year-olds in a high quality early education program, which can range anywhere between 4,000 and 5,000 children. So it was quite an undertaking for her to continue that process with no staff. So when our team came on in approximately October of 2015, since there had been a lag of no school readiness in the entire state, people forgot what our unit can do for them, what we can do to assist and alleviate some of the stress of their workload. So it is very exciting and very motivating that we will have these valuable tools to be able to present when we're out in the public, letting them know that we are available to assist and hopefully alleviate problems when children can't get enrolled. Workers are so busy that since there's really no state or federal law that requires this population to be in school, sometimes, if they apply for a program and it's full, many times because of time allocation, they move on to the immediate need of the safety and well-being of the child, and sometimes the education component may not be prioritized. With this population, 3 to 5-year-olds having the highest suspension and expulsion rate of any age group in the education field, it's so critical that these children are getting the services that they need.
Thank you so much, Diane. I appreciate that. I want to just ask one more question of the team. I'm curious, as a result of the project, the materials, the strategies that were created, what are you most interested in carrying forward into your work?
It's Diane again. I'm really excited about the one-pagers that have been developed with requirements for each program. It's going to be very easy to hand that information out in meetings. One of the things that has been another challenge for school readiness is, even though there's an intergovernmental agreement between DCFS and the Department of Health and Human Services Administration for Children and Families, with the early Head Start programs, and the Department of Human Services Head Start State Collaboration Director, there's not a lot of knowledge base that were available to assist. So the handouts that have been provided are going to be just very, very awesome to be able to hand out at meetings to get our name out into the community.
And I think, as the administrator, what Diane was saying is, that is definitely something that we can utilize, that one-pager when we go to conferences, when we go to parent-like picnics, just to be able to hand that out and to do presentations at POS agencies. But I think all of the information that was presented to us is so valuable. And again, like I said, initially I was like, oh, this is going to be such an overwhelming project, but it turned out to be very simplistic. Both Renee and Debbie were very receptive to any changes that we made, responses. I couldn't have asked for better partners in this, and it really just did I think, improve our relationship. So, thank you.
Thank you. We couldn't ask for better partners either, so thank you so much. Thank you for what you shared today. I wanted to share this little visual here. We had a really great wrap-up call with the school readiness team in April, kind of our second stage of materials that we created. We were going through a co-creation session, and we had a little reflective session on our time together, and we asked what we would name our time together in a word, and some of the things that came out were awesome, inspiring, collaborative, informative, helpful, responsive, and valuable. And I might add Diane's word of motivating too. I feel motivated still today about this project and this work. And I think this just really speaks to the power and the importance of collaboration and those cross-sector partnerships. We also just wanted to share this great message back from the school readiness team. I appreciate all the effort in the project to promote the school readiness team. The materials you produce will be invaluable as our team moves forward in assisting caseworkers and families to ensure our children are in the best educational setting possible. It will be very exciting when we get approval to start using these documents. It has been a great pleasure working with each of you and look forward to future projects. Thank you. And thank you, school readiness team. It has been a pleasure working with you. And we're excited too because we feel like these strategies, these documents can really make a difference for caseworkers to make things easier and to make things easier for our families, our most vulnerable families and children across our state. So we're excited to test further and iterate and see how we can make these documents and strategies even better. So I wanted to make a few comments just on what we learned through this project and this partnership. So in our collaborative final wrap-up call with the school readiness team, these are a few things that came out for us. We learned that a shared vision, mission, and goals within the partnership can really help to solve problems and improve systems and really bring people together around a process and a strategy. We learned that buy-in around experimentation and innovation is critical. So using those ideas of designing together, prototyping, testing, and using iteration are really helpful to just do those small experiments, really see what works from the user's perspective, and refine things from there. So being okay with the idea of experimentation and innovation. Also the importance and the power of data and using user insight, using that research and charting a direction and designing strategies. We also developed a greater understanding of the school readiness team's role and of each other's systems. We learned about the importance of involving experts of the system and users of the system in all stages of the process, so that being the school readiness team, the caseworkers themselves, the families themselves. We saw firsthand, like I said, the power of cross-sector, cross-system collaboration and alignment. And as we're sharing today, it's important to bring people together into this work and into this process. All right, in terms of next steps, the school readiness team is hoping to finalize some of these materials, seek approval from DCFS, and then to further test them with caseworkers and families to gather feedback and refine and iterate further. And I'd like to take a pause there and take some questions from our audience and from our participants. So feel free to chat into the question box there, and we have Edna and Carla on the line that are going to field some questions for us in the school readiness team. We actually have one in the room, so let's start in the room. Please, if you want to introduce yourself too.
My name's Stephanie. I'm the public policy manager at Children's Home and Aid. I have actually two-part questions. One would be, has there been any conversation about inserting this information in these one-pagers, finding a space for that in foundations training for new workers? I know, so I came from child welfare out of state into a supervisory role. So I was learning, like, how does Illinois work? And there's a lot of focus at that time on, like, issues in child welfare and not a lot about practical things that you need to know. And so workers came out of that training like, how do I do this? How do I do this? How do I do this? And all things like you learn on the job. But I feel as though there's been a shift in the last, I know they've been refining and improving that training over the last couple of years, and I feel like this is great information that if workers had at the front door, they would know that that early learning for their young kids, and a lot of kids coming into care are little. And I'm sure it's the same for intact. I mean, there are greater vulnerability levels, so they're more likely anyway to know, like, we're telling you this up front, that means it's important, as opposed to, like, this is something you don't learn until you have to learn it. That's, like, a conversation that can be had with the department, because this is some stuff that they need to know.
Yeah, well, I can answer. I'll try to answer that really quickly. Because this sort of falls into that category of not necessarily a small experiment that can be easily implemented and tested. One of the bright spots we found in the focus groups was some of the caseworkers who were working with the parents in DCFS, TPSN caseworkers, really being resourced and trained well in this navigation process. So in that original opportunities memo, we talked about the idea of sort of leveraging that training that they experience, and you know, certainly looking to other resources as well, but to have that be a part of some of that initial training with caseworkers. So as you said, so that it's a priority from the very beginning, and that you have the tools, not just the idea that it's important, but how do I do it kind of thing.
Yeah, I just think that's so much like that kind of primacy effect thing, where if it's one of the first things you're hearing, you recognize that it's first level like role of your job is to like education piece, and early learning is a part of education. And kind of piggybacking on that, when we talk about POS agencies, I hope, and I know this is still like, there's going to be approval and stuff like that, that the brown bag lunches and things that like engage with POS can eventually sort of be owned by POS as far as like getting this information to line supervisors and managers, because they have more access to teams that are working directly with, because you know, anytime you try to do a brown bag, you probably get half the caseworkers there because half of them are in the field, they're in court, they're all over the place, and turnover is wild right now, to where like to expect the department wouldn't, I can't imagine, be able to even just keep up with that together with everyone. And so there's some space to own that going down the road. I think that would be really great, so that teams can have that conversation at their meetings and distribute the documents and things like that, because that'll be such a big part of it.
I think that's a great idea, and that was one thing that Mary Beth had described early on, is getting access to those POS agencies is really challenging for them as a team, and it's a large state, so getting across all these different agencies is difficult. So themselves doing all those brown bags would be really hard, but I love the idea of they own that, and those materials then are there for them. And then just going back to your comment about the foundational training, like Debbie said, that came up in our focus groups, from supervisors, from caseworkers, needing that onboarding support. But like you said, it's about education, but it's also setting expectations kind of early on that this is important. So yeah, that's been a part of our conversations, and some recommendations we have for DCFS more broadly. Yeah. Any other questions? Edna and Carla are managing our question box. I don't think they have any yet. Anyone on the phone? I might throw one out to our audience while the wheels are spinning, and maybe another question will come up for us. I'm curious if you see any opportunities for your own work here. So in learning about the process that we used, our cross-sector collaboration, do you see any opportunities for your own work? And is there something you wish to try or that you wish to carry forward in your own process or your own work? And you can feel free to raise your hand, and Edna or Carla can unmute you if you'd like to speak aloud. And of course, anyone in the room.
Hi, Renee. Can you hear me?
Yes.
Okay, this is Edna. So I think I'm curious to know if the one-pagers with the who to contact for the different regions and anything under enrollment, if any of those one-pagers that you all presented on, if that's something that could sort of from our and be able to share with the collaboration leaders that we already have contacts for, because I know sometimes maybe, you know, given the size of the regions that the DCFS folks, the school readiness team has to cover, you know, if it would be helpful for them if we were able to share it from our collaboration leader point, and then, you know, maybe collaboration leaders would be able to, at least they would know who to reach out to, what regions they cover, any, you know, maybe they could also share it out with the early learning and childcare programs that they also have relationships with, so that in a way, you know, we're approaching this relationship building, you know, from both sides.
Yeah, I think that's a great idea, and I think maybe we can just work with the school readiness team to kind of get those documents in their next stage of iteration, and also working with DCFS on their own approval process. But I think from our end, we'd be very interested in sharing and making those things available to collaborations and systems across the state. Any other questions coming in? All right. Well, I want to thank you all for being here today. I want to give a special thanks to our Innovation Zone funding and to Leah Powell, who's supported us in this project. I also want to thank staff here at Illinois Action for Children that have provided consultation on this project along the way. I also want to thank again the school readiness team. I also see that Chris Foster is on our call today. She was our focus group facilitator. I want to thank you for being with us at the start of the project. I also want to thank Children's Home and Aids for their collaboration early on, and the Governor's Office of Early Childhood Education for their continued support and feedback on many of these materials and strategies. So thank you again for your questions and your time today. It's clear that together across our systems we can co-create in order to improve our systems for the most vulnerable children in our state. And I wonder, what will your role be as we go forward? If you have any questions as you leave the presentation today, feel free to contact us at any time. I want to thank you again and have a great day.
Thank you.